if you suspect a patient having urinary incontinence, as you guys know, urinary incontinence is stress urinary incontinence, overflow urinary incontinence, urge urinary incontinence, and neurogenic urinary incontinence. And I believe all of you are aware on how to treat them, but make sure in order to diagnose, you take a history, you do a urine analysis with culture and staining, basically, and sensitivity if infection is suspected. Do urodynamic studies. It's basically the studying of the bladder and how the urine is passed through the urinary tract. A stress test is basically done for patients who have stress urinary incontinence. And this is the treatment for urge incontinence, is basically bladder habit training, botulinum toxin injection, some anticholinergics, and tolidron and oxybutynin. So this is urge. We know that it's causing so much muscle contraction. Therefore, we're gonna stop this by giving specific medications. But don't give Botox, of course. Usually, you're not gonna give a Botox. That's in cases of other medication failure. So you see, this is what I'm trying to say when it comes to the things like that are not as important. I mean, that are going to be mostly last resort. First resort will be anticholinergics, right? And after that, it will be Botox. And bladder training would be even number one. And then after that, it will be anticholinergics and then Botox. So keep yourself this like non-invasive first and then invasive first, or drug that are most dangerous next or third line. Treatment of stress incontinence is weight loss, Kegels exercises, bulking agents to decrease the basically constipation and remove the material of the fecal material out of your stomach, of your colons. Surgery such as slings and artificial sphincters can be surgery can be performed, such as these specific procedures. These are some diapers. I believe you guys are aware with the diapers, some causes of the urinary incontinence, like example, delirium, inflammation, infection, atrophic vaginitis, pharmaceuticals like medications, psychological, excess urine output, and restricted motility and stool impaction. Okay, so I